One of the hardest things about supplements is that you have to take them every day. So it needs to be very easy and convenient. What I often tell my patients is if they're new to supplements, keep them next to your toothbrush, brush your teeth, take them and go to bed. Just make it as easy and routine-like as possible. But one thing that I found really useful with my patients and with my kids are sublingual sprays, because instead of swallowing a big clunky tablet at night and sometimes feeling nausea or having your tablet affected by food, to just get immediate sublingual absorption, it goes straight into the body from a little spray, is a very, very convenient way of getting supplements into your body. I like it with iron, I like it with the B vitamins, and we've realized that vitamin D and K as a combination are very, very important as well. So very nice daily vitamin. There's been a large study recently that actually pegs vitamin D more as a hormone than as a vitamin, because it has so many key roles in the body. I think actually it undergoes 300 different processes that it aids in the body. And it's best absorbed with vitamin K, so you often find now that your D will be mixed with the K. And there was a big study that came out in the past month that just having adequate doses of vitamin D daily, so like your 2000 international units, actually is a factor in longevity. So people who have that live longer. One thing you must realize about these hair supplements is they've all been tested and very specifically mixed. And a lot of hair supplements contain biotin, which is great, and it does definitely help when you're regrowing your hair. But one thing you must realize about biotin is you must always mention it to your practitioner, because it can affect laboratory blood tests. So especially if you're doing your cardiovascular markers, thyroid, you need to mention that you're on biotin, because these levels can look quite different. So don't forget, if your doctor asks you on any medication, mention everything. Creatine has become very popular, and for good reason. I do believe in taking creatine monohydrate for muscle and brain health. But one of the questions I get asked is, does creatine cause hair loss? There was one small study done a few years ago that suggested it may, and recently one study that said it doesn't. So what I would say is in most people it doesn't, and it's so beneficial, especially for your over 40s and people who just need muscle and brain health. But if you start creatine and within a month or two are shedding, then I definitely would blame that and wouldn't take it. So play it by ear, but the majority of people that I've seen don't have hair shedding from creatine, but definitely do from any testosterone-based supplement. So I'm not saying don't take it, but if you are going the route of testosterone, you need to do something to protect your hair.